Hello, welcome to HCA 316. My name is Paul Schneider and I'll be your instructor this semester. We'll be going over the next 8 weeks or 8 modules looking at healthcare information technology as it relates to healthcare administration. Now, I personally have a Bachelor of Science in Nursing from Ohio State University, and I also have an MBA from Franklin University in Columbus as well. But for the last 20 years, I've been working in healthcare or healthcare IT, and primarily I worked as a floor nurse when I initially graduated, then moved into hospital education, and I was in charge of the McKesson HBOC training for Ohio Health prior to moving on to vendors. One of the last vendors I worked for out in Kansas City, Missouri was Cerner, and Cerner is one of the top or leading, at least by revenue standpoints, electronic medical records, EHRs, in the country, and also has a footprint overseas as well. For Cerner, I was a clinical strategist, and I worked with other healthcare professionals as well as with the programmers of the applications, so that whatever item that we were programming or whatever application we were working on, that the end users actually saw what they intended to see or what they were looking for. So sometimes there's a disconnect between clinicians and the programmers, and indeed just about any other profession, with what the clinicians need versus what people feel that they need. So my job was to kind of be a translator, and perhaps some of you one day may also take on a translator role as you translate between clinicians and other parts of the organization in healthcare. With the programmers, my team was responsible for something called end pages, and what end pages was an HTML representation of the data that is inside of the database. So one of the things we'll talk about is a master patient index, as well as the databases that hold patient information. Not only does it hold patient information, it also holds other kinds of information as well, whether it's revenue cycle, whether it's information for population health, for quality, for human resources. So it's a point of bringing all that information together. And with end pages, what we did was pull that HTML view of that data point forward like a web page for each specific clinician or for that clinical need. So for example, a pathologist may have a different need than a radiologist does looking at patient information, which is completely different from pharmacy, lab, or for a nurse who at this point in time is doing a shift change with another nurse. So they may be interested in pain medication and when last dressings were changed, as opposed to a pharmacist who's more interested in, for example, weight, so that they can do weight-based calculations of medication. However, all of them may need to know when the last time medication was given, as well as the impact on the labs. So this graphic user interface, this GUI, this HTML bringing of this information, was allowing physicians and nurses and other clinicians and other professions to actually see clinical data. Because data is a point. And until we put that data together, we really don't have information. And the key is taking that data and turning it into information. And for a lot of reasons, I feel that IT in healthcare is really the linchpin that kind of holds everything together. Because without that piece of data that is then put together with other pieces of data to put information, it's very difficult to make decisions, either on patient care or on a hospital or healthcare system-wide situation. Now, right now, I work with healthcare organizations, but primarily what I do is I work with not just consulting organizations, but also with companies all across the country in different industries and different verticals. Healthcare is a specific vertical, just like transportation would be a vertical, agriculture may be a vertical, and you could also have those spaced out even wider than that. But for our purposes, what we're going to be concerned with is the healthcare vertical, and within healthcare, the healthcare vertical, we'll be looking at information technology and how it impacts that vertical. Now, as I mentioned before, the data that is brought together as information impacts a number of different things, not only the quality of patient care, but patient safety, their protection of patient health information, or PHI, protected health information, PHI, as well as reimbursement and the financial health of the organization. This information impacting the quality influences the regard of the organization among its peers, affecting marketing towards patients, towards clinicians that want to work for a high-quality institution. And it also impacts human resources within an organization as far as how they go out and market to clinicians or to other professionals who may want to work for that hospital. Of course, everybody wants to work for a high-quality institution. It also impacts whether or not patients decide to come. So that data impacts a wide variety, and you're really going to meet a lot of those different avenues or aspects of healthcare in your healthcare administration track. So with that being said, you could almost say that healthcare IT is the most important factor or most important part of your program. But again, this is just a facet of your journey in healthcare administration. But my hope is that you're going to gain the following understanding of healthcare IT by the end of this course. One is to have a basic understanding of computers, networks, and why we need or use healthcare IT. Two is the government influence with an involvement in healthcare IT, HIT, development and utilization. Some of the policies and some of the acts that have come along that have kind of shaped or created the healthcare IT environment, that we currently have. Also, electronic health records, electronic medical records, patient health records, what EMR, EHR, PHR, what are these different things and how are they similar and how are they different? HIT or HIT system selection and strategic planning. You may be involved in the planning or the selection of a healthcare IT system. Data privacy and cybersecurity is always a very big thing with HIPAA and protected health information. We're also going to look at patient outcomes and clinical quality and population health, revenue cycle, throughput and reimbursement, and of course marketing and consumerism. Now keep in mind, each of these weeks or each of these different modules actually could be their own course, if not their own course of study. So what we're really looking at is a high-level overview of each of these different aspects to give you a good, rounded, objective view of these different parts of healthcare IT and how they impact patients as well as you and your healthcare administration career. I'm very interested in the application of these principles and the application of this knowledge in real-world situations, because this is something you're going to be taking with you once you graduate. This is a very rigorous course. The first part of the course is going to be rigorous on reading and building a foundation of knowledge. Some of that knowledge you may already have. You may already know what a network is or what computers are or have worked with healthcare IT before. So these will be really quick refreshers for you. Others who have never had to deal with computers before, we are going to talk about computers at a very basic level and build up to the healthcare IT and the different systems that are involved with healthcare IT. But the back end of the course is going to be much more heavy in the application, and you'll see some papers that you'll need to be writing. There will be some quizzes, facts early on, not so much in the middle or in the end, but in the papers will be a little bit more heavy towards the end because we're actually looking at these concepts and how we're going to apply it. We'll also talk about persuasive arguments, because you may be asked about a situation and they want your opinion of should we pursue this or should we pursue something different. And in that situation, you should be able to write a persuasive executive summary along with a persuasive argument. Anyhow, if you do need any help, please feel free to email me. You will have my Mercy College email address, as well as you can also arrange for a private phone call at some point in time. I wish you very well. This course is designed that if you do the things that you are asked to do, you will do extremely well. If you do fall behind a little bit, you still do have an opportunity to do well in this course, but I do really recommend that you follow the course, the syllabus, and of course give your best effort. Thank you so much, and I look forward to working with you.